I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about global health. Before I get into it, a few things I want to make very clear. One is that this is not any type of medical advice. If you have any questions about your health, please speak with your healthcare provider. And if you have any questions about your religion, please feel free to speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. Okay, so today I'm super excited to have on with me Dr. Kim Tranquada. Dr. Kim comes to us from Arizona. And Dr. Kim, if you could just introduce yourself to the viewers and listeners out there.
Oh, so first of all, thank you so much for having me on your podcast, and viewers, thank you for listening. So I'm Dr. Kim Tranquada. I'm an emergency physician. I'm physically located in Arizona, but I do travel all around the United States and now across the globe to carry out healthcare. So I'm the CEO and founder of a hybrid nonprofit for-profit organization called Healthcare Alliance for an Equitable World. And we are using telehealth to bridge health equity gaps to those that are the poorest and have the greatest need around the world.
Amazing. So I see that you've traveled to different parts of Africa and you provide telehealth services. Can you tell us more about what type of telehealth services you provide and what countries you've already provided care to, are providing care to, and hope to provide care to?
Yeah. First of all, we hope to provide care to the whole global south. That's where 84% of the world's population lives. And that's where 89% of the global healthcare workforce resides. So we hope to provide care all over the global south. But right now we're starting. So we have joined with our tech partner VC in 7 medical missions in the Philippines thus far, where we work in a hybrid model with in-person providers and telehealth providers, helping to increase capacity. So capacity building is a huge need in healthcare in under-resourced regions. And then we just launched at 1 a.m. this morning in Kenya, our local network of telehealth in Western Kenya in Siaya County, with 1 hub hospital and 2 clinics in the Masai Mara and a boarding school.
Oh, wow. Amazing.
We will add our international consultants to that within a month or 2. We're waiting for agreements with the Ministry of Health. It's really important that we work with the government and are in compliance with all local regulations. And we will then also expand to Uganda. They are part of this pilot program that we're carrying out in Kenya and Uganda.
Amazing. So what type of telehealth care do you provide? Is it general medical care? Is it specialized care? Is it women's health?
Yeah, it's all of the above. So, healthcare is government funded in Kenya and Uganda, and there's different levels of healthcare. And really, only a very few centralized hospitals, usually in the city, have the level of care you would expect walking into a hospital here in America, where they have labs and radiology and specialists and an OR. Most people are getting care at a local clinic that's staffed by a nurse, sometimes a PA or a nurse practitioner at a level 2 facility, and very limited point of care labs, radiology, plus or minus. And so what we are doing is first connecting those folks to their hub hospital, which they've never been able to do before. The
Mm,
hospital might be 1 or 2 hours away on a bumpy road that's only accessible by motorbike, something that the patients can't really do when they need a higher level of expertise. And so now we're connecting them to that hospital by telehealth. And then, secondly, when that main hub hospital needs a specialist, like a cardiologist, a neurologist, a pediatric specialist, et cetera, we have a global volunteer cohort that's available to consult with them as well. And we don't do this instead of the local healthcare system. The whole idea is to first connect the local healthcare system, create capacity there, and then be an additional level of support. So all care is being carried out by a local licensed healthcare provider instead of the international team.
I love that. So that, I'm just imagining that, I went on a medical mission in 2019 to Pakistan, and we taught the lay midwives over there. We were just teaching them with this butterfly ultrasound that we had. And we were just teaching them how to do like basic scans, for the moms when they're pregnant and things like that. And I'm just envisioning how just being able to connect the local communities with the local providers there, right? Just even via telehealth is really a game changer. I'm wondering, you probably have issues with like Wi-Fi, I would think, and electricity and all of that.
Yeah, so electricity is like the first infrastructure thing you need to even have the computer connect and the Wi-Fi. So we actually collaborate with other partners. So the International Engineers in Electronics, IEEE Smart Village, they have a nonprofit sector. We partnered with them to put solar in at all of these facilities, actually. So now they have solar electricity. And that's sufficient, of course, to power a laptop, which is all you need with a built-in camera. You don't need anything special, or a phone. In the most rural villages, I was there in April. In the most rural villages up on the mountaintops, even the laptop sometimes can't connect, but everybody's phone can. And so the platform that we're using, VC, is also available on the phone. So people can actually connect on the phone as well.
Yeah, no, that's amazing. And in terms of your volunteers, what type of volunteers do you have? I know you mentioned you have all different specialties. Like how do you get these volunteers, and then like what is the process? Let's say that there's somebody that's listening to this podcast right now and thinking that they've always wanted to do some type of medical mission work and are not able to take that time off, which I think is fantastic for your organization because you don't need to actually get up, on a plane and go somewhere. You can just provide that care just through your own laptop or desktop to somebody else in a different world. I mean, different country, right?
Absolutely. And we have gone out of our way because I'm a working clinical professional, right? I understand the barriers to carrying out global health, even when you really want to. We make this super accessible, only 2-hour shifts. So we send out a schedule, people sign up for 2-hour shifts, and you can do that from your home whenever you want. We have a website, HAEW.org. You can go on that and use the contact us link to contact us, or you can contact me directly, Dr. T, Dr. period T, at HAEW.org to volunteer. And then we validate people's medical licensure and certification before they can volunteer with us. So it's super simple. And the math for even 2 hours, if 1% of the 13 million doctors we have in the world right now volunteered only 2 hours a year, we would have 700 extra doctor hours every day to do this work and treat 500,000 more patients around the globe in places that need it the most.
Yeah, that's those numbers are really staggering. I mean, that's phenomenal if you could do that. And I think that really comes with awareness, right? Like physicians are so busy, as you know. You're a physician, you work, and we're burned out. We don't know. Well, but at the same time, we went into this because we wanted to make a difference. We wanted to help individuals, right? Some of us have, really want to make a global impact. And so this is really the opportunity for those clinicians to really get a chance to make that global impact if that's something that you've been wanting to do your whole life, because it allows you to do it from the comfort of your own home.
Absolutely, and it makes global health now accessible to everybody. I think
Yeah.
there's been a huge barrier to people doing global health. You had to have time to travel, you had to have money to travel. You couldn't have responsibilities that you needed to serve every day, like, children or elderly parents or et cetera. And so now global health becomes accessible to everyone in the medical community. And by being a network, by sharing our expertise, we now can have a really high impact, scalable difference on health equity, and not in 2 generations, not in 3 generations, in this generation.
Yeah, that's amazing. So I actually was doing something like this, at least was trying to. After my medical mission in 2019, I had gotten in touch with, a physician and a hospital and this and that. But the problems that I came across, and I'm curious if you come across these problems, is that there was a lot of like red tape, like physicians outside of that country were not allowed to provide care, and it wouldn't be that we were providing care. It's more like we were doing like a consultation of sorts, right? So you're not actually providing direct patient to patient care or contact. And I'm wondering if you run across any of that type of scenario where people are really hesitant to partner with you because one, you may not know the language or the culture and all of this, but that there's like regulations within the country as well about physicians outside that country providing care.
Absolutely. And first is to understand and respect that those regulations exist for a good reason, right? To protect the local population from inappropriate, culturally inappropriate, and even predatory practices, right, from
Right.
corporations. So, first, we understand that. And then, secondly, is understanding that we're on the forefront, right? This kind of global healthcare commodity doesn't exist yet. So, we're on the forefront. So, creating the avenue is going to be a huge part of what we do. Um, I thrive in that environment. I worked in the federal healthcare system for 13 years and figured out ways to innovate while understanding the rules and creating new rules. And so it's really important that we do what we're doing now, which is create pilot programs and show proof of concept. You have to come with value. You can't just come with an idea. You have to come with a proven concept that brings value and then build upon that. That's how you build trust. This is trust building. You have to build trust with local leaders, and you have to build trust with local communities. So, yes, it starts with a big idea and all this wonderful projection, about what we can do. But then it starts with having the ability to execute and carry out the local logistics to make it really high quality and really high value. And then work on a way for it to be profitable and sustainable in the long run.
Absolutely. So I'm curious, of course, as a gynecologist and as a menopause and sexual health specialist, I'm curious to know.
Women's health is one of the greatest needs, by the way, in this population. So go,
That's what
please.
I was just gonna. That's what I was just gonna ask you. Is what, are you providing women's health right now? What are you doing?
Yeah, so women and children's health is important. The concept that we have in the United States of medicine being segregated into specialties comes from an incredible place of abundance. Um, in the places we practice, medicine is carried out by generalists, and generalists take care of everybody. They take care of babies, they take care of women, they take care of geriatrics. They do it all. And so, yes, we absolutely provide that care. Um, the Sustainable Development Goals, as they're developed, uh, does specifically address needs of women and children because historically, there are more barriers for women and children to care. And so, as you build systems, you don't want to continue that legacy. You want to build systems that are going to give equitable access and make sure everybody's going to be able to benefit in that way in order to make the world better. Why are all of us doing this? We're all doing this to make the world healthier, to make the world safer, and to give more people the opportunity to bring their gifts to the world. Because in the end, when you help a woman, a child, I don't care how poor they are, you are helping them bring their full potential to the world, which is going to help all of us. So we keep that big picture in mind, right? Why are we all doing this? So yes, we do absolutely provide care to children, and we do absolutely provide care to women, and all across the spectrum. So we have a emergency medicine team that provides immediate care if there's an emergency, and then they sort of triage the need to specialists who can provide subspecialty care if that's what's needed. And then those emergency medicine specialists can decide how long that patient can wait for the care. Is that a specialist you need now in the next hour? Is that a specialist you can wait till tomorrow and get those patients set up with that care?
Hmm. Well, that's great. Yeah, so I'm looking forward to, hearing more about the women's health just because obviously that's what I do, but I know that there's such a need throughout the world. I think, what we take for granted so much here being, so lucky honestly to be here in the United States is that we have access, right? We have access to care even for individuals that do not have insurance, they can go to a hospital. And we have laws that say that you have to see those patients and you have to provide care.
That's me, emergency medicine. That's what we do.
That's right. But that's not the model throughout the world. And so it really is, what you're doing is so, so important in terms of trying to get care to so many different parts of the world. What countries have you worked with so far?
So we've worked in several rural places in the Philippines.
Okay.
And now we're working in Kenya and Uganda within the next couple of months. And then, quite organically, as I talk about things like this, I'm contacted by people all the time that want to collaborate with us. So in Rwanda, we have a collaboration we're working on in South Africa, in the Democratic Republic of Congo. So there's always projects that we're working on, and they're not all exactly the same model, right? So one of the really exciting things about this is building it in a way that's customized to the local need in the local community. So one of our projects is telephysical therapy for people that have had road accidents and have had major surgeries. And unfortunately, the recovery rate for those folks is very low. They go back to their village and they can't participate in physical therapy. And they have very poor recovery rates, and they don't recover function again. So we're working on a physical therapy program to bring physical therapy not only to their local clinic, but give them something they can do at home as well to continue their physical therapy and to measure. It's going to be important. All of this is data, right? Is going to be research based. Is to measure the impact. Is this going to make a real impact? You anticipate it will. That's why you do it, but it's also important to measure it.
Yeah, absolutely. No, I think it's, I'm so glad that you are collecting data because that's obviously very important for, more VC funding or for, for grants and things like that, right? You need data because people want to see that you're actually making an impact and it's just not all ideas, but
Correct.
it's actually, changing, that there's some transformation occurring, that there is value in what you are doing, which obviously there is. I would love to do something like this for Pakistan. I mean, I think, I'm already thinking, as entrepreneurs, we
Yes,
like,
that's what
like,
you do.
we have, right. So Dr. Una says we have like 50 ideas when we take a shower. So, yeah, I mean, I think that, having something like this is so, so important. And I think that, I mean, I don't know who your liaisons are at different parts of the world, in different parts of the world. I don't know. I'm sure there are probably people that are part of that country, but I think that that's really important as well, right? Because then, I mean, you can't know everything,
No,
right? So you need your, your liaison, your contact person over there to help guide you, to tell you, what are the social norms and what are this and that, so that you can provide that care. I mean, I just see in so many different parts of the world how women are often in the shadows, right? They're often ignored. There are women's health, forget it, right? There's not, like you said, there's no, not in all parts of the world do you have, specific gynecologists and things like that. You may just have a general practitioner. So, in the parts of the world that you've already started working with, what type of specific women's health questions do you get?
Wow. I uh, Funny thing is, most of the women's health issues we are currently aware of, and we'll become aware of more of them as we do them, are around pregnancy and childbirth because it's a super high risk time for really life and death complications. Women that haven't had equal status in society will tend to not concern themselves with their physical well-being, but when it comes to their birth of their children and the lives of their children at home, they are very engaged, right? And so a lot of the issues come up around childbirth. The clinics we visit, where the midwives do incredible work with very little. So, patients give birth in a simple building, open air building, where the midwife doesn't have access to oxygen, has simple bulb suction, the stuff we use just to suction the nose after birth. They don't have advanced resuscitation capability. And if the patient happens to have a complication before birth or peri-birth, they're bleeding, they have a placenta previa, they have an abruption. Unfortunately, help is an hour away on a motorbike, and not a special motorbike, uh, a guy that you flag down, and you have to sit on a motorbike, which is very unideal.
Yes.
So there are really great needs. And look, we're not here to say we can solve all these issues, right? But bringing visibility and bringing resources to the needs is a roadway to addressing the needs.
Absolutely. I mean, just shining a light on it, right? And letting others know. Oftentimes we are in our bubbles and we don't we don't really see what hardships so many people throughout the world undergo. And I think that, you by doing this help others to see how even just 2 hours a year can make a difference in someone else's literally their life, right? Like it could be life and death. And to your point about women delivering, when we did that the training in 2019, it was, it's talking to the midwives, and it's talking to the lay midwives, and it's talking to, how do you handle hemorrhage, right? And here we're very fortunate we have access to so many different medications for hemorrhage, but they're lucky if they have Cytotec. So they have, Cytotec in perhaps their little bag that they go and they deliver women out in the field, wherever they're delivering the women. And most of these women are anemic, right? Because they don't have access to meat. They don't their food is not fortified with iron or with folic acid. So sometimes the babies have like anencephaly, or they will have spina bifida or things like that, because they don't have access to fortified foods like we do here in the U.S., right? So even if doesn't know she's pregnant, if she's eating like the bread or the cereals and stuff like that, she'll get the nutrients that she needs for her developing fetus. Whereas over there, they don't have that. And so women will come in just like what you said, right? And they'll have their deliveries, but you don't know, they may have a hemoglobin of 6, and then they go and they deliver their fifth child, their fourth child, whatever, and have a postpartum hemorrhage, and then they die because they don't have that volume to begin with. And if they hemorrhage, they literally just will die because they don't have access to the blood, they don't have access to the
Correct.
medication. So
And there isn't an ambulance to take you somewhere quickly, and
no.
a lot of things that we take for granted.
Yeah, yeah, absolutely. And so, I think that's phenomenal what you're doing, because it's really providing care to those that are the most vulnerable. And just 2 hours, a year is really not much to ask of, because sometimes we just spend those 2 hours scrolling on our phones, right? Doom scrolling, just looking at all this other nonsense, when we could be helping somebody out. So I
Yeah.
think that that's great.
And I know you mentioned butterfly ultrasound. So there's lots of companies innovating in this space. So Butterfly is one of the ultrasound companies with a small portable ultrasound that you can connect to your phone. And so one of the things about doing projects is like this is then you can start building an infrastructure to bring some of those needed things in, like butterfly ultrasound. There's a company that flies medications and blood by drone all over Africa. And
Mm,
so getting more private partners involved, it just becomes an expanding circle of resources that we can bring to help bridge this equity gap.
yeah. Yeah. I think that's, again, what really, it's so needed what you're doing. And by doing this, you are really, showing others how they can help, even with just little time or little money or whatever. But, I'm really curious to know, what are some future projects that you're thinking? I mean, I guess there's just like so much that you probably have so much on your plate. Do you have somebody else that you work with, or do you have partners, or what do you do?
So I tend to partner with lots of folks. So one of our partners is Global Telehealth Network, and they are funding this Kenya and Uganda project with the solar and with the laptops for these facilities. And through Rotary International, um, having local leaders that can help us connect to the Ministry of Health and to connect to the leaders of the hospital. So Rotary International has been important in this sort of international on the ground presence to help carry out these projects. And then, of course, VC, whose platform we use for the telehealth connection. So it's like we're not building everything in house, but we're bringing in partners to fill in all the holes. And then IEEE to do the solar. And then in terms of me, yeah, this is a lifelong thing with me, with doing lots of stuff. That's okay. I thrive in challenge. So yes, actively always building my team. We have a board of advisor team now, representing people from across the globe with different specialties, and always building my administrative team. We're 100% self-funded right now, and by that I mean me funded. Um, so look, there's some wonderful things about that. Anybody that works with us doesn't have to worry that we have some kind of corporate connection or that we have some other motivation for what we do. So it has a benefit, but it does mean our team is small for now, and that my ability to scale is small for now. And that's okay. I've built a lot of things over time. Sometimes it's really good to build slowly and meticulously before you scale, because you really hold on to your quality, value, and trust. I mean, that is the basis of everything, right? Making sure what you build is 100% aligned with your outcome, not making mistakes because you're trying to scale to make some VC happy or to pull in a profit. It's just really making sure you create high quality, high value, and that the people you work with can trust you.
Yeah, yeah, that's so important. So, I mean, I just have so many questions for you. I just think that there's so many different ways that, we can help, and there's so many gaps in care. And I think that, you and I once talked when we met at a conference,
Yes,
and at one of the EBS conferences. And I
yes, I
think
remember.
yeah, and I think I need to discuss that with you again, because I think that there's opportunities that I can see for you in different parts of the world. And for me, it's for bringing care to different parts of the world, but specifically to Pakistan. And there's some, like in Pakistan, and I'm sure we see this in a lot of different parts of the world, but the rich are super rich, the poor are
Mhm,
very poor,
mhm.
like so poor. And when you see that, you see the inequity there in that country, and it's really heartbreaking, right? And you try to figure out, like, how can you help? How can you help change this? So I'm so excited that you are creating such a massive change in the trajectory of health in the world, and for all that you do. So, what would you, if you could say, your message to the physicians out there listening, what would you tell those physicians that are wondering how they can help? And I know you mentioned that you can go on your website and apply, but what is something that you tell physicians that just wins them over and says, yeah, they absolutely have to be a part of what you're doing?
So, first of all, I think all physicians want to do this. The physicians that do this don't feel burnout, they feel the opposite of burnout. This connects us back to the lives of impact and the lives of addressing human suffering on a global scale that made us go into medical school in the first place. Uh, when we do surveys of doctors, up to 90% of them say they're willing to do this, and they're willing to do this as a volunteer, because I know them. I know this community. This is what they want to do. It's not that, and secondly, this does not impact their current career, their current life. They don't have to travel anywhere. They don't have to leave where they live. Their families can continue to go to the same schools. They can continue to go to the same jobs. And for just a few hours, a year, a month, however often they feel they can do it, they can not only provide this care, but be part of an international community. That's going to change medicine for all of us. To be connected, not just to your local physician group in your hospital or in your group that you practice, but to be connected to physicians from all over the world, and to be seeing what healthcare is all over the world, is a game changer for medicine. And I think we need to step up and be those leaders and to change medicine to what we always believed it could be.
Yeah. Yeah, absolutely. So maybe you could tell us again. So for those individuals that are listening, perhaps those that want to get involved, how can they get in touch with you? How can they follow everything that you're doing? Do you have a blog? Do you have a website that you post updates to?
Yeah, so we have a website, haew.org. From there, you can link to our podcast, Voices of Healthcare Equity, where I actually speak with other people all over the world doing this kind of work. Because in the end, to have a global impact, it's not about what I own, it's about the connections we can make to serve people all around the world. So I'm building a global community through the podcast. And please, either through the website or by directly emailing me, dr.t at haew.org, reach out to me. We will add you to our newsletter and send updates. I also have a YouTube channel where you can see both our podcasts and some videos about what we do. Oh, and follow me on LinkedIn because I put most of our updates there. Please continue.
Right. What words of perhaps hope or inspiration would you like to leave our listeners with?
I think, especially now, we need to lead with hope. We need to lead with light. We need to lead with generosity, respect, curiosity, and connection to the people in the world around us. In one of the darkest times of my life, which was during COVID-19 as an emergency physician, it was connection to doctors and medical professionals and researchers around the world that gave me hope, that gave me guidance when my own government could not give me guidance, and that kept me and my team alive. And I think we need to remember that lesson and to continue and to grow that global connectivity.
Well, thank you so much, Dr. T, for coming on and telling us about your inspirational story and how physicians can make changes and how they can help lead the change throughout the world, and how all of us can really help with just 2 hours a year. And by volunteering that time, I think that that is a very doable time frame. And you, as somebody that constantly hopes to make a change and a difference in the world, I think that, this is something that's very doable and something that's very easy. So thank you so much for coming on. And I really appreciate your time.
Thanks for connecting with me.
Yeah, of course. And while we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. And if you want to get involved with Dr. Tranquada's mission, definitely please reach out to her and volunteer your time if you have time, which I know that most of us do have time. So please absolutely reach out to her. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening. Yeah. So as Dr. Sarah Ionescu was talking about, she said, it doesn't matter what you do, just get started. Even if it's for a minute, just do something, do some type of movement. So, sometimes when you're sitting at your desk and you are super tired but you need to, you need to do something. So, you can go ahead and grab your little weights. These are 3-pound weights. And, you can even just start like lifting them over your head, right? You want to do that maybe for like a minute. I know, don't comment on my form. I can just see somebody being like, that's the worst form I've ever seen. Okay, but listen, the point is to just do something, right? So I'm moving, right? That's key, is that I'm moving. And or right, you do like little biceps. But I will say that I do lift heavier weights than 3-pound weights. Okay. So don't crucify me. But the point is just to move, right? So we can move, we can do some overhead exercises, we can do some triceps, you can do, right? You can even hold both of these. Dr. Von der Wright calls these the mamby-pamby weights, but it's okay, we can still use them. And you can do your, right, like your triceps, right? Again, don't kill me about my form if it's not perfect. Or you can do your biceps. So anything that you do is key, even if you have, right, say you don't have weights at home. So lift something, maybe like a gallon of water or something like that. So whatever you do, the key thing is to move. So I hope that you will join Dr. Sarah Ionescu and myself as we continue to ask people to move. So movement is key. Movement, building muscle is the key to longevity. And so hopefully this episode will get you motivated to get up and move.